Hi, I'm Steve Strobridge,
And I'm Kathy Beasley.
and this is MOAA Focus. And the Deficit Commission finally came out on the 1st of December with its long-awaited report. Not a whole bunch new, but there was one big thing new. They went after Medicare supplements in a big way. What are they talking about?
That's right, Steve. They're cutting coverage instead of raising fees, and that's a big change here. And the bottom line is still the same. More people are going to pay more out of their pockets for their health care than before.
Yeah. So what kind of things specifically did they propose?
Well, the plan's going to require that all Medicare supplements charge a $500 deductible, and that would only cover the first 50% of the next $5,000 in their doctor bills.
Okay, so if you add a $500 deductible and you only cover 50% of $5,000, that's another $2,500. We're talking about an extra $3,000, up to $3,000 a year out of pocket for TFL
That's correct.
eligibles.
You're going to be paying more out of pocket, and these requirements would apply to TRICARE For Life as well as all civilian health plans,
Okay.
or civilian federal health plans, I
Right,
should say.
and all supplements. And
Yeah.
that's kind of the intriguing thing, because we've seen this kind of proposal in the past, specifically aimed at TRICARE For Life. And the purpose was clearly to save money on federal expenditures. So
Correct.
you can say that for TFL, you can make that case for the Federal Employees Health Benefits Program, but they went after all civilian supplements. Seems like the government doesn't save money there. What's the thinking there, do you think?
Well, I think the thinking is that if they're assuming if civilians have to pay more out of their pocket, they'll cut down on unnecessary doctor visits and maybe wait until Monday rather than visiting an emergency room over the weekend for
Okay.
a doctor visit.
I see. Of course, on the other hand, there are a lot of other studies that say, if you start charging people more out of pocket, maybe they wait until they get really sick and not see a doctor when they should. All of a sudden, when they do decide that it's time to go get care, all of a sudden you're
They
looking
could
at a
be sicker.
hospital visit
Uh-huh.
instead of a doctor visit. So
That could happen.
That can
Mhm.
backfire. One of the other things you can't help wondering about, one of the critics of these various commission proposals has been AARP, criticizing the Medicare changes, criticizing the Social Security changes. AARP is the biggest supplement seller. Can't help wondering if maybe this is a commission way to try to, get a little dig back.
Well, it could be, but there's another very big issue here. And so many of the media reports out there are saying none of this would affect our wounded warriors. Well, that may or may not be true here, and we're looking at it a little more carefully. But I don't think a lot of people understand that our most severely wounded warriors use both Medicare and TFL.
That's right.
And they're the ones who could really stand to be hit with both of these
That's right.
proposals here.
The wounded actually could get a triple whammy here. People don't appreciate, we've got retirees in their 20s. If you're disabled and get more than a 30% disability rating, you are medically retired.
That's
They're
correct.
going to be eligible they're going to get hit with the same TRICARE fee hikes that we've proposed for all retirees under 65.
They'll be hit 3 times.
That's right. If you're severely disabled, then you get put on Medicare. You have to pay Medicare Part B premiums in order to get TRICARE For Life as a wraparound to Medicare. They don't have a choice about it. So you have some of these very severely disabled retirees, severely wounded warriors. They have to have TRICARE Standard or TRICARE Prime for their families.
Medicare.
They get hit with this $1,000 to $2,000 a year increase for that the commission is proposing. You got to pay Part B premiums, which is another $1,200 or $1,400 a year, which they wouldn't have to pay if they weren't wounded. And on top of that, this coverage that they just bought with the Part B premium, we're talking about cutting the coverage for that
That
for
can
$3,000.
be up to $6,000 a year
Just
more that they're going to have
for the
to pay.
wounded warriors.
That's correct.
And that's way more than anybody else would get hit. So it's a pretty bad situation.
Well, Steve, quite frankly, it's a travesty. And when the new Congress convenes this year, we're going to put together a campaign that's going to address this issue.
That's right. This is something that we think the country needs to get excited about. You can talk about the cuts for the people under 65. You can talk about the cuts for the general TRICARE For Life population. When you're talking about messing with the very severely wounded warriors and make them pay up to $6,000 for the privilege of being wounded, that's a problem. We've got some difficulties with that. We're going to make a big time challenge out of it.
Yeah, that's for sure.